Our next topic is aplastic anemia. So aplastic anemia means aplastic anemia is basically it includes anemia as well as other cell lines are also reduced due to bone marrow failure of bone marrow to produce any cell line or failure of hemopoiesis. So it is characterized by pancytopenia and hypoplastic marrow or hypocellular bone marrow. These are the two diagnostic features for aplastic anemia, that is pancytopenia on a full blood count and hypocellular bone marrow on bone marrow biopsy. Bone marrow is usually replaced by fat cells. Most causes of aplastic anemia, they are autoimmune, triggered by drugs. There are some other triggering factors as well, such as viruses, hepatitis, and radiotherapy and chemotherapy. They all can cause bone marrow suppression or bone marrow failure as well. But mostly aplastic anemia is autoimmune. Autoimmune destruction of the bone marrow and replacement of the bone marrow with fat cells is the main pathophysiology of aplastic anemia. Aplastic anemia can present abruptly or it can present insidiously over weeks to months. Thrombocytopenia and neutropenia, all of them will be present, such as pallor, headache, palpitation, and dyspnea. Symptoms of thrombocytopenia, such as mucosal skin or mucosal bleeding. Visual disturbances can also be present due to retinal hemorrhages. Petechial rashes can also be present. And symptoms of neutropenia, such as infection of upper and lower respiratory tract, skin, mouth, and perianal areas, they may also be present. Now, the next point that I'm going to tell you is important. There's no lymphadenopathy or hepatosplenomegaly. So lymphadenopathy or hepatosplenomegaly will not be present in aplastic anemia, while the other causes of pancytopenia, such as ALL or AML, in both of them, there will be lymphadenopathy and hepatosplenomegaly. So pancytopenia without lymphadenopathy and hepatosplenomegaly will most likely be aplastic anemia. Pancytopenia with a normal peripheral smear or unremarkable peripheral smear will be aplastic anemia. Pancytopenia with hypocellular bone marrow, aplastic anemia. So these are some points on the basis of which you can differentiate between aplastic anemia and leukemias.
Can you say that please again?
3 points on clinical examination. If no lymphadenopathy or hepatosplenomegaly, it will be aplastic anemia. Most likely, on initial investigation, that is peripheral film, it will be unremarkable. No abnormal cells will be seen on a peripheral film. And the third one is on the diagnostic or definitive investigation, that is bone marrow. So pancytopenia without lymphadenopathy and hepatosplenomegaly will most likely be aplastic anemia. Pancytopenia with normal peripheral smear or unremarkable peripheral film is again aplastic anemia. Pancytopenia with hypocellular bone marrow, again aplastic anemia. So marrow examination is needed for the diagnosis, and to define aplastic anemia based on full blood count and bone marrow findings, at least 2 of the following must be present: hemoglobin less than 10, platelets less than 50, and neutrophils less than 1.5. Any of the These two must be present to make a diagnosis of aplastic anemia. Important note is that the blood film morphology is unremarkable. Aplastic anemia is a pancytopenia and there will be histological evidence of hypoplastic bone marrow. It is a diagnosis of exclusion and can only be made by bone marrow biopsy. So only bone marrow biopsy will confirm the diagnosis of aplastic anemia. Key points are again the same key points: pancytopenia, histological evidence of hypoplastic bone marrow is will make a diagnosis of aplastic anemia. So this was all about aplastic anemia and its diagnosis. Our hematology chapter is finished.